When we're moving air through our intestine, it can growl, especially when we're hungry. Our brain actually sends messages to our intestine, get ready, there's food coming, and it'll start moving more. So that's completely normal. You do need much more sleep when you're pregnant, and don't try to give yourself an extra jolt. Actually, cut down on some of your activities, take some naps, go to bed earlier, do whatever you can for the health of yourself and your baby.
Just sneezing and sniffles and stuff, I'm kind of stuffed up.
So sneezing, actually, you can get with both, and that's actually how you spread the virus. When you sneeze, you're spraying out virus particles, which is why it's so important to, when you sneeze, try to cover up. But no, if you're sneezing a lot and you have a really runny nose, yes, more the cold than the flu. So this is really common. It happens to all of us. And basically, when we're sleeping, we're not producing as much saliva as we normally do, so our mouth gets really dry and bacteria can overgrow. So what can you do? Well, in addition to obviously brushing and flossing before you go to bed, drink a big glass of water. That'll help you stay hydrated throughout the night, and it'll hopefully prevent a little bit of the morning breath.
Okay, you guys know when you're dating somebody, especially when you're dating somebody new, and you have morning breath, oh my God, they want to kiss you in the morning, and you're like, we can't do that. So if you drink a lot of water before you go to bed, and you wake up with that new guy, it won't be as funky.
Exactly.
Nice, but then you're going to be peeing all night. But you'll be fresh in the morning.
The other thing is, as soon as you get up and he's still sleeping, just run to the bathroom and brush your teeth.
Just run to the bathroom and brush your teeth.
How possible to have such a severe addiction as we are now, hearing reports of, although toxicology reports have yet to confirm that, and still be coherent enough and still be able to perform as we did see with Michael Jackson, as he did?
Well, I mean, it's surprising, but we have to remember this is someone who's been performing and dancing, from early childhood. So for you and I, if we were taking the amount of drugs that we've heard he's been taking, we would barely be able to walk.
Right.
But for someone who has been doing this for a long time, and also
you can train yourself to build up to that.
You can train yourself, and you also become tolerant to the drugs. So if it had been going on for a long time, he may have built up such a tolerance it didn't affect him as much. But this is all speculation. We don't know what he actually had on board. He does look very fit in the video.
And interesting that, as we heard in Jeff Rosson's report earlier, investigators have confirmed to NBC News that Diprovan was among some of the paraphernalia or drugs that they seized from the house, in Michael Jackson's house. So tell me about Diprovan. I mean, this is a powerful anesthetic that, as I understand, is only used in ORs.
Absolutely. It's really only appropriately used for medical procedures or surgeries. It's a very powerful anesthetic, and it's not abused because it really just puts you to sleep. It doesn't give you any sort of euphoria or high. So it's very irregular for him to have it in his house, and it really suggests the desperation that he may have felt to get some sleep. We heard that he was so troubled by his insomnia, and that he had this in his house. It never should be there legally.
In fact, reports that back in 1997, Michael Jackson hired Dr. Neil Ratner, an anesthesiologist, as his tour doctor during the History concert tour, and that, according to reports, he brought along IV equipment and was treating the pop star's sleep disorder. So it seems to go along with that, if he needed to bring an anesthesiologist along with him, here was somebody who had a serious problem.
Yeah, but this is a very unusual, I would say, completely inappropriate use of Diprovan. We don't use it to give people a good night's sleep. It's an anesthetic. It makes you unconscious. The interesting thing is it's very short acting, so it is possible that he could have taken this even a few hours before this video and be fine, because it's out of your bloodstream within a few minutes, but it's not something you're supposed to use for sleep.
The president, not much to fear here. He's doing what he should be doing, right?
Exactly. He's getting a routine colonoscopy as a follow-up. He did have a history of polyps, and he's doing what every American should be doing, which is getting checked for colon cancer.
You talk about that history of polyps. He's had one of these while in the White House, but one prior, and that's when the polyps were found?
Exactly. And so a polyp is just a benign growth. It grows out of the lining of your colon, but it can eventually grow into cancer, and that's why if we find a polyp, we always remove it. And that's what we're looking for when we do these colonoscopies.
And when you find a polyp, you're also asked to come back with more frequency.
Exactly. So if you had a totally normal colonoscopy the first time, you wouldn't need another one for 8 to 10 years. But if you do have polyps, you would need it much sooner.
45 million Americans who experience headaches. Getting some much-needed relief may be as easy as taking off your earrings or blowing out a burning candle. Health Magazine's Dr.Raj has helpful advice on stopping the pain and pressure before it even starts. Dr. Raj, good morning to you.
Good morning,
nice to see you. Now, we're not talking about those occasional headaches you get from something like a sinus infection. These are headaches brought on by things that in your environment pretty much every day.
Exactly. They're unusual causes, but they're caused by such everyday things that people usually don't even think about.
Let's start with perfume, because that's something you would not normally associate with a headache. How do the two relate?
Well, any strong odor, whether it's perfume or a strong detergent, can cause headaches in some people. And we think they're activating the nerve cells in their nose, which are connected through pathways to your brain, to your headache center. So it can trigger a headache in susceptible people.
And it doesn't have to be a bad smell. It can be whatever the smell is.
Right. If you're particularly sensitive to it, it could trigger it, whether it's a pleasant smell, an air freshener, or a very bad smell or a strong smell like a Clorox bleach or something like that.
So if you're getting headaches, maybe get rid of all that stuff and see if they go away, and that'll give you an idea of whether that's what's causing it?
Exactly. And you can try to change your laundry detergent, get a fragrance-free detergent, fragrance-free soaps and lotions. That could all help. Okay.
Another thing that causes occasional headaches is Al Roker. Well, Al Roker's weather, essentially, and changes in the weather.
Yes.
Why does that trigger a headache, and with whom?
It's interesting. Some people really can say, I can sense when a storm is coming because I get a headache. And we think it's due to electrical changes that, because the atmosphere, affect their nerves and can trigger off headaches. And different people get affected by different things. Some people can sense a drop in barometric pressure. Some people are sensitive to temperature changes, and it's often a change. So like what we've been experiencing this winter, one day it's very warm and humid, another day it's cold. People really feel it in their heads if they're susceptible.
So you can't change the weather patterns, obviously,
No.
So how do you deal with it once it's there?
Well, in general, people with headaches should keep a headache diary. So when they get a headache, if it's weather related, write down what the weather is that day, and then you can sort of predict. You check your weather forecast for that week. If Thursday's going to be a bad weather day for you, you can prophylactically or preventatively take something like ibuprofen.
And in the case of perfumes or weather, is there one kind of headache relief that is better than another? Because they're all different. There's acetaminophen, there's aspirin, there's ibuprofen.
Right. They work almost equally well in different people. You should see what works for you. Acetaminophen or Tylenol is just a pain reliever. It doesn't affect inflammation, whereas aspirin and ibuprofen do. So for some people, for certain types of headaches, that works better.
Okay. And in these, would that work better, the ones we just talked about, or?
Yes, but you know, another thing other than medications are things like cold compresses. You can even use we have some frozen peas here, place it on your head. Often that cold can constrict your blood vessels and help with a headache.
Okay. Fashionistas out there should beware that something as simple as putting a headband in your hair can cause a headache.
Yes, if you're tightly pulling your hair back in a ponytail, or you're constricting it with a tight headband, you're basically causing a lot of tension to the muscles and the tissue of your scalp, and that can cause a headache. Even heavy earrings, yours don't look too bad today.
No, mine are light. Yeah.
Okay, yeah, that can also pull and cause tension on your scalp, and that can cause a headache.
So just loosen the band, is that enough to do it? Or?
Loosen the band, readjust your ponytail, and really, I mean, common sense would dictate, try to avoid prolonged periods with these things. So save it for a special occasion.
Okay. Now, I've often heard of food connected to headaches. Particular kinds of food?
Yeah, there are certain foods that can trigger headaches in some people. A chemical called tyramine is present in certain foods like chocolate, processed lunch meats, which we have here. So if you're someone, again, a food diary, a headache diary will help. And document when you get the headache, what foods you're eating.
If you combine certain foods, are you less likely to get a headache?
Yes. Well, certain people get headaches when they're hungry because of low blood sugar. So anything that's going to keep your blood sugar on an even keel, such as a complex carbohydrate with a protein, so fish and brown rice, a lean meat such as chicken can be good, wheat toast with almond butter, these are great combinations. And then certain foods have magnesium, which we think help prevent or alleviate headaches. So spinach and nuts, those could be good.
Okay. And finally, normally you think of having a headache as a way to avoid sex, but you say that sex can bring on a headache.
In some people, they're what we call coital headaches, and these are usually due to tension that's building up in your head and neck during sexual activity. So what can you do about it? Try to take your pace a little bit slower, ease into it, and that should really help. But you can always preventatively take an ibuprofen beforehand.
And the same is true of exerting yourself too much in a not frisky way. I mean, just normally.
Yes, any kind of vigorous exercise can bring it on. So again, take it easy.
All right, Dr. Raj, thank you very much.
Thank you.